All right, Dr. Kaitlin, thank you for joining me today. So
Oh,
today we are doing a Q&A focused on women's health, pelvic health, and I thought you'd be a great person to do that since you're a PT who specializes in that. So why don't you, give everyone a little bit of information about, what you do, your experience, and where you're located.
awesome. Well, thank you, Dr. Jamie, for inviting me and having me. I just love this collaboration model between PTs, even across the United States, which is just amazing, right? Taking advantage of virtual stuff. But yeah, thank you for having me, and I'm happy to be here. Again, my name is Dr. Kaitlin Haider, and I am a women's health physical therapist with a background in sports medicine. So I have a little bit of a unique background in the sense that I was a sports med physical therapist and athletic trainer before I really niched down and started working just in women's and pelvic health. And I'll talk about that in a little bit. So to a little bit more about me and my practice is called Fit PT, and it's located in Hudson, Wisconsin, which is just right on the border of Minnesota and Wisconsin area here. So if you know where St. Paul, Minnesota is, we're just like a hop, skip, and a jump 20 minutes east of there. But I have a little boutique physical therapy. I call it a studio, not even a clinic. And if you look on my website sometime, I think you'll be able to see kind of how that feel is a little bit more boutique-esque rather than just a clinic or hospital-based setting. And we really enjoy having it that way because I feel that, especially being a women's health facility, it's nice to have women come in and they feel like they can get their tea and their coffee on their way in and feel a little bit more it's kind of like a boutique fitness and wellness and medicine type of setting. And I think that that's really nice to have as just something different. But we really specialize in working with the female athlete and active women in general. So we tell people all the time that if you're not jumping out of bed in the morning, feeling super energized and strong and pain free and ready to start your day physically, then we should chit chat because we want all of our women in our community to be active and healthy and well throughout not just now but also their lifetime. And I have a huge passion for working with runners. Myself as a runner, a recreational lifelong runner, but also just the patients that I've gotten to work with in the running communities, both from a recreational, fun little pastime a couple days a week runner to the person who is actually competing in triathlons and ultra marathons and Ironmans and all that fun stuff too. I love it all. And I think that it's just such a unique practice because my background working with sports athletes has brought me to this place where now I really enjoy working with female athletes of all abilities and ages. And I think that, being a women's health physical therapist, I have such a passion for helping women to take more, empower them to take more power and just, you know, strength and confidence in taking care of their physical bodies. Because a lot of times what I see in my office is that, this too, Dr. Jamie, like people come to us when they're injured and they're not feeling well and they're not feeling their best. And sometimes they're like completely throwing their hands in the air and they're like, I'm not running at all and I'm so miserable. And we don't want people to even get to that point, right? Like we help people when they're in those places, reel them back in and get them feeling better. But it's really nice to be able to have, a relationship with women and have them, say, Dr. Killing, you're my physical therapist. And I come to you when I have just, questions or I have little aches and pains, or I come to you monthly because I want to stay active and well, and I want to keep running. And so we have within my physical therapy practice, we have all of those options for people to see us when they're in need of physical therapy care. And then also when their body is already thriving and they want to continue to thrive and have more of a wellness based model, which is really fun too. So
Yeah, I was just gonna say, just from like a cash practice standpoint, it's so nice being able to see people who are healthy but want to get healthier or want to avoid
yeah,
injury. Like you can't do that with insurance-based practice, unfortunately.
yeah,
So it's so nice because it's like, well, you get taken out of running and just think of what that period of time is like for you. People get really
hmm
down and feel defeated, and it's just hard to, I don't know, those periods are so hard. So it's like, well, it's nice to just avoid them altogether, right?
Exactly, exactly. And I find that, maybe if someone's never been under that model of healthcare before, it seems a little strange. Like, well, why would I come to you if I don't have any issues? Which is a fair question. I completely get that. But I also think, why do we go to our dentist twice a year and get cleanings? Or why do we, supposedly, hopefully, go and see our medical doctor and have an annual physical exam or a biannual physical exam? Why do we do those things? It's so that we can stay on top of our health and wellness, and that we can have the information so we can take action if action needs to be taken. It is no different in the physical body. And what we are, Dr. Jamie, as physical therapists, is we are the movement and physical body healthcare practitioners. So if you're having orthopedic pain, in our setting, we're treating orthopedics, right? If you're having pain in your muscles, your joints, your ligaments, your nervous system, etc., that's what physical therapists do. That's our expertise. And so if you're not thriving in those areas, or you're potentially super active and, putting those areas to be vulnerable, you should be seeing a physical therapist on a somewhat regular basis, or at least have a relationship with someone so that they're there if you need them. And unfortunately, the insurance-based model of physical therapy is you can only see a practitioner if you are in pain. And it's even gotten so bad that once you are not in pain anymore, even if you haven't accomplished your goals, a lot of times they'll kind of kick you out before you're even feeling like you're ready to be done with PT. And that's really unfortunate. And one of the things, I know we're going to talk about this in a little bit, but one of the things I saw in my previous, very standard orthopedic insurance-based practice that I was working in was I would see a lot of postpartum mothers and a lot of, active people that I had been working with prior to pregnancy. They get pregnant. We work together in adapting their plans and how they're going to be exercising maybe a little bit differently during pregnancy, but they can still stay active. And then postpartum, they would come to see me to say, okay, my body feels totally different now. And now I got this little one. And how do I get back into it? How do I get back into running? I've been a runner my whole life, and now my body feels different. And so we, as women's and pelvic health therapists, we help women through that process. But one of the unfortunate things is this was, a woman who maybe would be, I saw this many times where they would have their insurance cover their care for 6 weeks, 8 weeks, and then they're like, nope, now you're done.
Yeah.
And it's like, wait, hold on a second. They haven't even ran a mile yet. And so it just offers a lot of freedom in the cash-based model. And I'm sure that you have this experience too, but I think people are pleasantly surprised when they meet with a cash-based practitioner that our rates are more reasonable and affordable than they think they're going to be. Because we're not billing insurance. It's just a fee-based exchange. And so we're able to, especially for people with high deductibles, keep things really reasonable and affordable. And I don't know about you, but I accept HSA, FSA, and I think people are super excited to hear that. So it has its pros for sure.
Absolutely. Yeah. I feel like we could just have a whole Q&A about just being cash.
I know.
But I
know.
want to get into the women's health stuff. I love everything you just said. I completely agree. That's part of the reason why I decided to go cash based as well. So I'll just say that and kind of leave it there.
Awesome.
So I really want to start off by you kind of describing what a women's health PT is. I feel like it's becoming more well known, but still isn't, because it's such a niche, specialized thing with specialized training. So I was wondering if you can just kind of start off describing and explaining what that is for people who maybe don't know what a women's health PT is.
Yeah, great question, Jamie. Okay, so a women's health physical therapist is someone who specializes in the female body as a whole, and even more specifically around the pelvis. And you'll hear in the medical world and even in our physical therapy professional world them be called pelvic health physical therapists. And I like to say women's health and pelvic health therapists, that term is synonymous. So you might see that written somewhere and they mean the same thing. At least in my mind, they should mean the same thing. So the reason that I tend to clarify myself more as a women's health therapist is I don't just treat the pelvis, and I don't want that to be deceiving. So we specialize in pelvic health. So we dive a little bit deeper in our education and our certification courses to learn more about the pelvis and the pelvic floor and the core, and how those areas of the body specifically are impacted in the female body. Now, there are a lot of pelvic health therapists that also treat males, so that's also something to duly note. I personally do not treat males for pelvic health. I only treat females. At this time, that's just where my passion lies and my training lies, and I believe it's good to just know what you know and know what you're good at and stick with that. But just so your audience knows that males also have a pelvic floor, they also have a pelvis, and there are practitioners out there that do treat that area of the body as well. So some common conditions that we'll treat include pelvic floor and core rehab. So any sort of dysfunction within the core system or the pelvic floor system, whether that's pain or leaking or abdominal separation, discomfort or tightness or tension in the muscles surrounding those areas, we will treat all of that and we will help patients overcome those conditions. The other things that we're really well versed in is like SI joint pain, or pelvic girdle pain, pubic bone pain, low back, hip, and I just say low back, hip, and pelvic pain are kind of our jam. Ironically enough too, this doesn't get talked about, but we'll also deal with some bowel and bladder issues. So I mentioned leaking, which a lot of, people kind of women perk their ears up when they hear that, like, "Ooh, leaking, what do you mean leaking?" Yeah, we can treat that. We absolutely can, whether it's stress or urinary mixed incontinence or urgency. We can treat the variety of those things. We just have to figure out what the source is coming from. And so that's something that we do. And then, as well as, many people don't realize that we can treat pelvic pain in the abdomen, such as like endometriosis. We don't cure endometriosis. I'll be very clear about that. But I do have a lot of patients with endo that have a lot of muscle tension and fascial tension because of their pain that they have surrounding their menstrual cycles. We can actually work through those muscles and that fascia to help alleviate some of that tension that could be exacerbating their pain. And then also we'll treat things such as like chronic constipation. And so again, it's not necessarily curing constipation. Sometimes we can, depending on what the source is. But many women's and pelvic health therapists will actually, they're trained in that bowel health as much as bladder health as well.
So I love everything you said there. I think it's a good segue into what I was hoping to talk to you next. So different myths and misconceptions that people have about pelvic health or the pelvic floor. So I noticed for myself, so I'm not a women's health specialist, but things that I've noticed is like people who, especially women who are older and men too who are older, thinking that leaking is normal. It's a part of aging. And then you mentioned men, they can see, pelvic, they can get help for pelvic health as well, where I feel like it's thought that, this is just a women's thing, so women's issue.
Yeah.
So
Yeah.
what are some of the things you've noticed through your practice?
Yeah, so common myths. I love this one because I feel like I lived this out myself, and this is kind of how I got into this world. So biggest things are, I hear from women all the time, especially in the running and active community, is just once they've had babies, leaking is just inevitable. Like sometimes you struggle with a little bit, sometimes you struggle with a lot of it, or it gets worse over time as you age. Having babies and children and having pregnancies and births does predispose you to leaking because something came out of your pelvic floor or out of your abdomen that kind of messed up the core and pelvic floor process. I'll say it that way. And if that doesn't recover or get the attention it needs to heal after you have a pregnancy and a birth, then that can cause issues and that can cause leaking. And that is a very solvable problem. Okay. And so that myth that that's a badge of honor and you're stuck with it for the rest of your life as a female is very false. And the reason I say that, I've kind of lived this out. So I'm 30 years old. I have no children at this time and no pregnancy history. And I had trouble with leaking as a child, actually. And I never told anyone about it. But knowing what I know now, I realized that I was having some core and pelvic floor dysfunction related to tension and tightness. So this is leading into my next myth, which is the belief that if you're having urinary leakage specifically, but any sort of incontinence issues, if you're leaking, many people believe that it's a weakness issue. And they believe that doing Kegels will fix the issue. And they're very surprised in a negative light when they find that Kegels are not solving their problem. And that's a complete misconception. Kegels have a time and a place and a purpose, but a lot of people aren't doing them correctly. I'll say it that way. And also, many people aren't doing them, or they're doing them when they shouldn't be doing them. Okay. So Kegels are not meant for everyone at all times of life, and even with incontinence. So that's another myth. So basically, leaking can come from tension, even maybe more so than just strict weakness. And so that's why it's really important to meet with a women's and pelvic health specialist. A physical therapist will specialize in assessing this and also treating this to delineate, okay, let's say Dr. Jamie, you came to me and you're like, I'm having some leaking issues and I'm not sure why. We actually, through a series of questions and a full body scan and assessment and some internal examination, can possibly delineate, well, I should say we can delineate, why, Dr. Jamie, are you having that leaking issue? Is it because of weakness? Is it because of tightness? Is it a discoordination issue? There's many different reasons that can be happening. And so I really empower women to recognize that leaking is not normal, and they should seek help if they're wanting to solve those issues, because it's very solvable. What other myths are out there? Oh, I don't know if this is necessarily a myth, but this is more like a false interpretation I think we live in our world, that you should be able to just jump right back into exercise after you have a baby.
Yes.
That is huge, especially in the running world, because as runners, we love to run. That is like our sanity. And so when you're a new mom and you are stressed to the max and you are just like locked into that little baby all the time, and you're like, I need an out, I need to get out of the house, I need a break. What do people do? They jump right back into walking and running. And a lot of times people jump into physical activity too quickly, and that can also lead to pelvic floor and core and pelvic girdle dysfunction. Sometimes it's not right away. Sometimes it's months or years later. And so, when we live in the world of social media and people are constantly sharing how quickly they got back into running or the gym space, or how quickly they got their body back, I think that gives women a very false interpretation of what is realistic. And so what I would say to most individuals, it depends on your specific pregnancy and birth experience. But for the most part, it took 9 months to grow a baby inside of you, and there was a lot that changed and happened. It's not going to just go back to quote unquote normal or something similar right after having a baby. So I'm talking about, it took 9 months to grow a baby inside of you. It's going to take 9 months to a year to feel like your physical body, your muscles, your joints, your ligaments, etc., are going to feel like they're getting back to your normal self. And that also has to include some sort of work and rehab with it. It doesn't just magically happen. We got to give it a little bit of support too. So I'd say that's another big one that comes to mind, is the recovery piece from, I'm speaking a lot about the pregnancy birth piece, because in women's health, we see a lot of that. I specialize in the postpartum care, but even just from an injury, we have to honor our bodies and
So,
the healing process.
oh, sorry, I'm talking over you.
No, go ahead.
I'm wondering, how often do you have people come in and say, well, Dr. Kaitlin, it's been 6 weeks, I've been cleared from my doctor to do all things. So I should be able to do everything.
Yeah.
So can you kind of like process, talk a little bit about like, well, yes, you've been cleared for everything, but does that actually mean you're ready for a high impact exercise and being able to go back to what you were doing 9 months ago?
Yeah, great. So I get that all the time. Like, I want to say daily. Because and depending, a lot of the women who come to my office with that statement and that question, they're like, I was cleared, but I tried to do some things that didn't feel right. Or I tried to do some things and I'm not so sure I should, or my friend told me I shouldn't. So I'm here because I don't know what to do. Um, Basically, when you get clearance from your medical provider at 6 weeks, they are looking strictly at your tissue. So if you had a C-section, they're looking at your C-section scar. Is it healing properly? Are there signs of infection? How are you doing? Are you able to stand upright? If those things are checking the boxes, they're saying in their scope of practice, you are okay to go back to normal life. We are not concerned about a red flag emergency, big emergency situation going on here, right? We don't need to admit you to the hospital. That's what they're saying. If you had a vaginal birth, they're doing an internal exam and again, making sure if stitches have to come out or things are healing. They're looking at your pelvic floor tissue. So they're looking at if there were incisions, are they healing? Are there signs of infection? They aren't looking at muscle strength. They aren't looking at pelvis alignment. They aren't putting you on a treadmill and having you run for 10 minutes and seeing if you can do it. Nor should they. But they're not assessing your function. They're assessing, is there any sign of infection or emergency condition that we would need to seek further medical care? And if you check the boxes and you're doing great, then they kind of leave you out on this little hiatus of, okay, you're good to go, just do what you can when you feel able to. And that's a loaded statement because for people who were active previously, I find that they do one of two things. They either go back into exercise way too quickly and too aggressively, and that ends up causing issues down the road, which can be leaking, pain, injury, abdominal separation. Those are kind of the big ones. And again, it's not always right away. Sometimes it's later. Or they're scared because they heard that you can develop all of those things. Or maybe they tried going back and exercising and it didn't feel right. So then they just don't exercise. So I get a lot of women who come into my office who are either way over exercising way too fast and their body has not recovered yet, or people are way under moving and under exercising because they are scared of doing the wrong thing. So we have deconditioning and overtraining, and that becomes a big issue. And we can find somewhere in between those things. And that's, again, what a women's health physical therapist will help you do, is to say, okay, this is, your pregnancy birth history. This is where you're at right now. This is your goal. Let's create a strategic, customized plan to get you there. And let's make sure your body heals appropriately. And so when I say that I see, women can take 9 months to a year to recover, doesn't mean that I'm seeing them in my office weekly for that. Usually I'll see them weekly when we first start. I really like women to, in my practice, they have a virtual phone call with me about 3 to 4 weeks postpartum. It's enough time to get them home and settled in with baby and, their new life, and have a phone call so we can chat about any immediate questions. And then I have them come into my office the same week or the week after they get clearance from that 6-week mark with their medical doctor, so that we're able to start right away with, okay, this is where you're at and this is where we're going to go with things.
Yeah, I feel like you touched on so many things, so I just want to mention a few things. I love that you talk about kind of working in the gray. So, just having this idea with runners, like, I'm going to go all out, I'm going to run through pain, I'm just going to 110% all the time, leads to breakdown, right? So it's going to lead to injury, at some point. It might not be tomorrow, but, a year from now, 5 years from now, it likely will. But then the opposite side of things, where it's like, well, I'm going to sit on the couch, I'm just going to recover for a week, 2 weeks, not run, leads to deconditioning. Our tissues aren't going to get healthier, right? So I love that you mentioned that. It's like, our job as PTs is to see where you're at with things, where your tissues are at with things, so that we can build and get you stronger, so that you can run really well and not get injured, or to overcome an injury in a way that's like healthy and where you can get stronger. So I love that you mentioned that. So you're talking about pregnancy and kind of seeing, or, seeing people before they come see you, really getting things started right away. So I love that you mentioned that. It's like if you have things going on, or you think that you'll have things going on after a pregnancy, or just with anything, like getting it addressed right away versus, you know, doing a lot of Googling and hoping that you're figuring
Mhm.
out what it is and how to treat it. And you're just going to save so much time and energy and stress by seeing a professional, you know, and doing it right
Mhm.
away before things get even worse. So I loved everything
Yeah.
that you just said right there.
Yeah,
There was a question
absolutely.
I had from someone who follows me on social media. It was about pregnancy, and you talked about girdle pain and SI joint pain. So I was going to read their question. So she was wondering about what are some common postpartum girdle pain and SI joint concerns women typically experience, and then do you have any recommendations before women get pregnant or while they're pregnant, things that they can do to maybe avoid issues or minimize concerns after pregnancy?
Yeah. Okay. So that was a loaded question. So I'm going to do my best to answer it all. If I miss a piece of it, Dr. Jamie, let me know. So when it comes to the pregnancy piece, let's start there and then we'll move to the postpartum part of the question. So during pregnancy, your body is going through a whole host of changes. And as soon as you are at 8 weeks of pregnancy, your brain especially starts to recognize that fetus as like, hey, there's a baby here. We're going to start working on changing some things. So some of the changes that happen is you stop utilizing your core system so much in your abdominals because your brain says, hey, we got to make room for baby to grow here. We don't want to stop using our core at 8 weeks while we're pregnant because that will contribute to a whole host of things. Because as soon as you start producing relaxin, which is that hormone that makes you feel loosey goosey in your joints, you're going to be like, you're taking your stability from up here and then it's going to here. And then if you're not using your core from 8 weeks to that 9 month of, pregnancy, you're bringing it to here. And so that's where people will develop a lot of instability and cause pubic bone pain, SI joint pain, low back pain, upper back pain, you name it, right? So, and leaking, that's also a big piece during pregnancy too, is that instability. So we want women ideally to understand how to activate their core. And when I say core, it's not your abdominals. All right. So for anyone who does not, if that sounds unfamiliar, please go to my YouTube page and watch the core anatomy video. Okay. So your core is this internal cylindrical system that actually includes your pelvic floor and includes a muscle called your transverse abdominis. And so I want women before they're pregnant, ideally, to learn how to activate those muscles and how to breathe properly so that when they become pregnant, and there's all these weird changes going on, it's a little bit easier to find and to learn again, right? Because it's always easier to learn something a second time or a third time in a change situation. So preconception, learning core pelvic floor work is ideal. Now, most people don't get that, all right? So then during pregnancy, I encourage my pregnant mamas to come in for at least one visit, so that we can talk about these things and we can get them activating these muscles. Ideally, before third trimester would be great so that they know how to activate them. Now, here's the other cool part. This wasn't a part of the question, but the transverse abdominis is a part of labor and delivery. And if you have a strong transverse abdominis, which is part of that core system, it will actually help you push to a greater capacity to get baby out. Okay. So everyone wants their labor and delivery to go smoothly. So that's like a great incentive. Like, train these muscles prior to pregnancy and throughout pregnancy safely. Okay. So by strengthening and activating your core systems the right way, that will help kind of internally stabilize and hold your pelvis steady like a little back brace. That will help avoid low back pain and SI joint pain and pelvic girdle pain. Okay, so that's the answer for that piece of it. Postpartum, remind me what she asked about postpartum. Was it kind of like to avoid the same kind of
Yeah,
things?
first common postpartum girdle pain and SI joint concerns that you typically see. So maybe
I
what's
mean,
abnormal and what's normal, and this kind of ties into
yeah,
a question we had later on, like when is it to a point where they should start seeing someone like you?
yeah. I would say any sort of pain doesn't matter what it's called or what the diagnosis is, any sort of pain during pregnancy and postpartum should be addressed by a physical therapist, and consulted maybe even with your medical doctor. Because if you're having pelvic girdle pain, if you're having low back pain of any sorts, there's something not normal there. There's something not structurally right, whether you're out of alignment or whether you're not recruiting correctly, whether you're weak. And we know that you're going to be predisposed to those things, but if you experience them, you really need to seek out care and help. And I would argue that every mother should consult with a physical therapist, a women's and pelvic health specialized physical therapist, between that 6 to 8 week mark postpartum, every single one. In the countries of France and New Zealand and Australia, just to name a couple. But a lot of the European countries will actually, once you have, just as frequently as you're going to see that provider 6 weeks postpartum for that medical consult, they go see a physical therapist as well. In the United States, it's not standard of care. So a lot of women don't know to do that. But I highly encourage you to see a PT during pregnancy, and then you'll already have a relationship, or you can shop around for the right one and then see a PT as well at that 6 to 8 week mark postpartum. So I'm not going to go into too much detail about what conditions to look out for, because I would just say any sort of pain in that region postpartum is abnormal and you should seek care.
Yeah, I like making it simple like that. I feel like you said, there's a lot of ideas like this is normal. So just saying like pain isn't normal. So get it checked out, and get it addressed by a professional, and before it turns into something worse too. So that's so interesting about France and New Zealand. You said Australia, right? That's so great. We'll get there at some point, but we'll see.
Yeah, right. Would like to go there. It'd be awesome.
Gosh, this is going by so quick. So I had a classmate who had a fantastic question, more for PTs, and I really wanted to throw it at you because it was so great. So Kat, thank you for this question. She says, what types of questions should therapists ask regarding pelvic health for patients with lumbar and or hip pain?
I love that question because Dr. Jamie, before I was a women's and pelvic health physical therapist, I didn't ask these questions. I was just an orthopedic provider, right? And not to say sports and orthopedics is awesome too, right? But I didn't know what I didn't know. And so I would highly recommend all therapists in their settings asking this question in an outpatient orthopedic and sports medicine setting, because even if you don't know the answer to it, it's going to kind of click on your brain and you're going to say, oh, this person might also need to see my friend who's a women's health therapist, or might also need to collaborate with someone in my community. So here's a couple examples. I would always ask in the intake form, are they having any sort of incontinence? And I would write it out very specifically. So I actually write it on my intake form and then I verbally confirm. So are you having any sort of urinary incontinence, which is, in parentheses, I'll put like a loss of bladder function. Okay. And then I want to ask about urinary frequency. Are you urinating greater than 2 to 3 hours, in between the hours of 2 to 3 hours of a span? Okay, I didn't say that well, but you know what I mean. So if they're going more frequently than every 2 to 3 hours, or you can't hold it for 2 to 3 hours, is what I'm trying to say, that could be a problem. Okay, that might need to be addressed. Another question I would ask is, are they having any sort of pelvic pain? Now, when you say that, they're not going to really know what that means a lot of times. So what I would delineate is, are you having any pubic bone pain? Are you having any low back pain? Are you having any inner thigh or groin pain? Are you having any sort of insertional pain or pain with intercourse? I would specifically ask those things if you're treating someone in that area, because they might answer yes to a big cluster of these. And then you might say, wow, I'm treating them for low back pain, but they've got a lot of pelvic health stuff going on. Maybe again, they should see a pelvic health therapist in addition to my care. I would also ask about bowel health. A lot of people shy away from bowel health. I would ask about constipation or diarrhea. I would ask about, you can ask about leaking in the bowel region too. That can be gas or poop, feces. And a lot of times too, in the orthopedic world, we shy away from that. We're like, wow, I don't want to ask that because I don't know what to do with that. But it can give us information. Okay, it's just information about the pelvic floor. and it might be pertinent to your care, to be honest. Um, let's see. I would also ask too, if it is a female who maybe has young kids, I would ask, how soon did you jump back into exercise or running after having your babies? Did you have any sort of, online recovery program that you did? Did you seek out, one-on-one professional help from a PT? Like, what did that look like? Because if they've got young kids and they're coming to see you for low back pain or pelvic girdle pain, they very well might have jumped the gun a little bit, and that would give you some helpful information. So those are the big ones off the top of my head, Dr. Jamie, but
Like that.
yeah, hopefully that's helpful.
It was, yeah. I like the fact that you have them on your intake form. I feel like even with coaching clients, they'll tell me things like, "I know this is TMI." It's like it really isn't. Like at this point,
Yeah,
I've heard everything. Like I'm not phased by literally anything that you tell me. So it's okay.
yeah,
We're people
yeah,
you can share this information with, even though you feel like maybe we don't seem like the people who would address these concerns. But for in
yeah.
your case, you are, but maybe people just don't know because they don't know what all you do. And I feel
Yep,
like with PTs in general, people don't know what all we do. So that's part of
exactly.
yeah.
Exactly. And I find too, because I used to work with male therapists, and because I was doing women's health in an orthopedic setting, both lots of male and female PTs, we ended up changing our intake forms to have the males put it on their intake forms as well. It was just standard throughout our practice so that they didn't have to ask the question. And maybe that patient didn't feel, if it's a female working with a male, maybe they didn't feel comfortable talking about it out loud or stating it during their assessment time, but maybe they still wrote it on the medical history. I know that when I go to the doctor's office, I mean, every time you're there, you have to check the little boxes in the forms. And some people just feel a little bit more comfortable with that. If they don't check the boxes, but you're still suspicious of some of those things being true, give them some time. It might not be the right time. Just like we learn in school, if you suspect someone maybe has a history of trauma, maybe you don't ask that on day one. And that actually would be another great question to add is, do you have a history of trauma? Because that might play a role too in their comfort level, not just with pelvic health, but also with just physical therapy. And we're very hands-on people. And I think sometimes it's easy to forget that maybe not everyone's ready and expecting that. I do ask to every patient that comes in. I do ask, have you seen a physical therapist before? Who did you see? What was that experience like? Because sometimes that can give me some good information as to what they've tried and what's worked and what hasn't worked. And so if they've seen a women's health physical therapist before, that also might cue you into, hey, maybe they've got some pelvic health stuff going on. Maybe I should ask a few more of these questions regarding to their hip and low back pain.
Love that. So this has been so helpful. I had like a number of other questions I was hoping we could go through.
Okay.
Maybe we can do like a second Q&A or something because I feel like we still have so much that we can talk about. But for now,
Yeah.
do you want to tell people how they can find you, following you on social media, your YouTube channel, things like that?
Great. No, thank you, Dr. Jamie. I appreciate it. I think we could talk for like a whole nother hour. But you can find me again. My name is Dr. Kaitlin Haider with Fit PT, and my Instagram handle and Facebook handle are at Your Fit PT. And you can also find me on my YouTube channel at Your Fit PT. And those are great resources for both clinicians and who are interested in pelvic health, but also for patients and clients because they share a lot of free information on those platforms.
Awesome. All right. Well, thank you,
Yeah.
Dr. Kaitlin.
Thank you, Dr. Jamie. I appreciate you having me.
Absolutely.